The second Africa Healthcare Summit has attracted actors and watchers of Africa's healthcare from around the world. Day one featured experts discussing a range of healthcare issues, including basic health coverage.
To begin with, I think an appreciation of the importance of healthcare in Africa is still not up to the standard or the level that one would expect.
Personally, I don't think we are where we want to be. There's a bit of health insurance. It just hasn't quite caught on the way we hoped it will catch up.
No doubt health insurance is important in achieving wider health coverage. But why are countries in Africa doing poorly in this area?
Opinion, the reason health insurance is not doing as well as it should do in Africa at the moment is because I don't think the management of the project is not doing as well as it should do. We find not just with the health insurance scheme, we do find that quite a few African projects are not delivering, and I think it just has to do with the project management side.
Because of the federal structure and the fact that you do have state-level players in healthcare, and of course you have local government players in healthcare as well. The state governors have not, subscribed as much as would have been expected.
I think until one is able to connect the link between health status and development performance, it would not be possible, in my opinion, to get African governments to accord a high degree of priority to health as a development goal in its own right.
Worrisome problems, yet one major one appears to be a shared pain on the continent of Africa.
Health infrastructure basically depends on reliable supply of power, electricity in particular. Now, if you have disruptions in electricity supply, if you have inadequate quantum of electricity supply, it is unlikely that you'll be able to provide medical care at the highest level at affordable cost.
Discussants proffered some interesting solutions, raising curious questions about government involvement in healthcare. Should governments take their hands off healthcare?
Government should not hands off. It's not going to work like that.
No, we are not at that point yet where government can totally hands off healthcare in Africa.
I don't think it's entirely possible for governments to be separated from the healthcare infrastructure of any country.
Should ministers for health be politically appointed, or should ministers for health be hired in a competitive recruitment process?
If the political appointees are not working for us in terms of continuity of healthcare, because obviously healthcare needs continuity for the success, for people to actually feel that they have good quality healthcare.
I don't think our problem in Africa is due to lack of competence or the absence of human resources in some of the key sectors. It is simply that governments are constituted on the basis of criteria which have very little to do with capacity to respond. So you put politicians who do not have a demonstrable track record to perform.
The ministerial appointment is political, but everyone under the minister is a bureaucracy. It is a Ministry of Health.
Really believe the Minister of Health should be skill selected. You require a certain set of skills to understand set problems and how to go around sorting them out.
Looking ahead, what next?
Is the solution. We've heard so much about problems. We have to start looking into solutions.
If you raised a healthcare fund from the Central Bank of Nigeria that is low interest rate, understanding that this is a critical sector that requires support, that would at the end contribute to economic growth and contribute to human development, I think it makes a compelling case.
We could get the communities organized better. We could get people to come together in groups. We have communities who have local cooperative associations. No reason absolutely why we can't run healthcare insurance streams using these guys.
It's day 2 and final day of the summit. There's so many exhibitors here in London at the Olympia Conference Centre. One would only hope that seeing so many people, so many variety of products, and so many foreigners involved and interested in the summit, that it spells good news for African healthcare.
Public-private partnership, or PPP, is obviously important in the development of healthcare for Africa.
The world of money, the world of financing or investments usually tells you the story on where a country, where a region is going. Today, I would say we're in a lucky position where there is not really a lack of money for good projects in Africa.
International organizations have shown good interest in championing and investing in the health sector in Africa. But what do they really have to offer?
So the company offers a range of ultraviolet indoor sterile air systems using UVC technology.
We're more than happy for people to approach us because we offer such a wide range of products, not just hand sanitizers, but also medical equipment and pharmaceuticals.
Okay, our products are laboratory and diagnostics, and of course in the area of HIV and AIDS, our products have been very, very applied in managing HIV and AIDS in Nigeria and in Africa.
Foreign investors who are doing business in Africa, are there any gains for the continent from the profits they make?
Talking about Nigeria, the GE Foundation has funded a whole holistic program of training of biomed engineers.
We are very involved with the advancements of skills back at our factory, where we take unemployed people and provide them skills and actually provide a lot of employment. Yeah.
And how does the African diaspora in the health sector fit in?
And we can use the Indian example. There are a lot of Indians that were used to be in the UK and the US. The Indian government made a concerted effort. They made a policy change which attracted people who are non-resident to come home, creating incentives, so physical, non-physical incentives, giving tax breaks, giving exemption on duty. And these are some of the things that can really help.
It's about time that we begin to challenge ourselves. I challenge ministers and I say to them, if you have a heart attack, your private jet wouldn't get you to the nearest place outside the continent to improve your survival rate. But if you have somewhere in your country, your survival rate will improve.
Whether or not this one summit can solve the problems Africa faces on healthcare delivery is debatable, but the good thing is that experts and stakeholders are talking and ideas are flowing back and forth.